I want to start today with a warning, and I mean that genuinely. By the time this video is over, you are going to be looking at the people around you very differently. Your spouse, your adult children, your friends at church or at the grocery store. You are going to find yourself noticing things you never paid attention to before. The texture of someone's skin, the color of their eyes, the shape of their nails, whether they are rubbing their lower back or squinting in dim light. And you are going to want to say something, to explain what you have just learned, to help. My advice is to exercise some restraint. People are not always ready to hear that the white spots on their fingernails or the cracking at the corners of their mouth is telling a specific story about what is happening inside their body. Choose your moments wisely. But for yourself, pay very close attention to everything I am about to share with you, because your body has been sending you signals for a long time. Signals that most of us have been ignoring, misinterpreting, or medicating without ever understanding what they actually mean. I am Dr. James. Welcome back to Senior Vitality Secrets. Today we are going through 23 distinct physical signs that your body is deficient in vital nutrients, not theoretical deficiencies, visible, measurable, physical signs that you can observe right now, today, on your own body or the bodies of people you love. Before we go through the list, I want to explain why nutrient deficiency is so widespread, even among people who believe they eat reasonably well, because understanding the cause is just as important as recognizing the symptoms. Why nutrient deficiency is so common today. There are 3 primary reasons why people become deficient in essential nutrients, and each of them is more common than most people realize. The first reason is digestive damage. Your gut is the gateway through which every nutrient you consume must pass before it can reach your cells. When the lining of your digestive tract is compromised, which can happen through years of poor diet, medication use, chronic stress, or simply aging, your ability to absorb nutrients is significantly reduced. This is called malabsorption. You can be eating a perfectly nutritious meal and still becoming deficient, because the absorptive capacity of your gut has been damaged. A specific form of this problem involves bile. Bile is a digestive fluid produced by your liver and stored in your gallbladder that is essential for absorbing fat-soluble vitamins, specifically vitamins A, D, E, and K. If you have had your gallbladder removed, if your liver is producing insufficient bile, or if bile flow is sluggish, your ability to absorb these critical vitamins is dramatically reduced regardless of how much of them you consume. The second reason is soil depletion and food quality. This one is less discussed but profoundly important. The nutritional content of fruits and vegetables is directly determined by the quality of the soil in which they are grown. Over decades of industrial farming practices, the mineral content of agricultural soil has declined substantially in many parts of the world. The result is that the vegetables and fruits available in most grocery stores today contain meaningfully lower concentrations of essential vitamins and minerals than the same foods contained 50 years ago. You can grow a tomato that looks perfect, large and red and visually appealing in soil that has been depleted of its minerals. That tomato will be essentially hollow nutritionally. Interestingly, the flavor compounds in vegetables are directly connected to their nutrient density. When vegetables taste remarkably like nothing, which is increasingly common, that absence of flavor is often reflecting an absence of nutrients. When you find yourself reaching for sauces and seasonings and processed flavoring to make food interesting, your body may be trying to tell you something about the nutritional quality of what you are eating. The third reason is that refined foods and sugars actively deplete nutrients from your body. This is the one most people understand least, and it is critically important. When you consume refined grains, sugar, and processed foods, your body must use its existing nutrient stores to process and metabolize them. Many of these foods have had their natural nutrient content stripped out during processing, yet they still require B vitamins, zinc, magnesium, and other nutrients to be metabolized. The result is a net nutritional deficit. Every time you eat these foods, you are drawing down your reserves without replenishing them. With that foundation in place, let us go through the 23 signs. Sign 1. White spots on your fingernails. Look at your fingernails right now. Do you see any small white spots or specks, typically appearing partway down the nail? Most people assume these are a calcium deficiency. They are not. White spots on the fingernails are a reliable indicator of zinc deficiency. More precisely, they are a sign that zinc has been depleted from your body, most commonly by excess sugar and refined carbohydrate consumption. Here is the timing detail that makes this particularly interesting. The white spot appears approximately 3 months after the depletion event, because that is roughly how long it takes for that portion of the nail to grow from the base to where it becomes visible. So, if you see a white spot midway down your nail today, your body is showing you evidence of something that happened to your zinc stores approximately 3 months ago. Zinc is one of the most broadly important minerals in the human body. It plays roles in immune function, wound healing, hormone regulation, reproductive health, cognitive function, and dozens of enzymatic processes. When sugar consumption spikes, zinc is one of the first minerals to be depleted. The solution is straightforward. Reduce sugar and refined carbohydrates, and ensure adequate zinc intake through food sources like red meat, shellfish, and pumpkin seeds, or through a quality zinc supplement. Sign 2. Persistently oily skin. If your skin, particularly your face, tends to be consistently oily, the answer is not a better facial cleanser. The answer is almost certainly zinc. Oily skin is driven by overactive sebaceous glands, the small oil-producing glands in your skin. These glands are regulated in part by androgens, the category of hormones that includes testosterone. When zinc is deficient, androgen regulation becomes disrupted, often leading to excessive androgen activity, and consequently to overproduction of sebum, the natural oil your skin produces. For women in particular, this connection is worth understanding in depth. Persistently oily skin, alongside other symptoms such as irregular menstrual cycles, excess facial hair, or difficulty managing weight, can be signs of polycystic ovarian syndrome, a condition strongly associated with elevated insulin levels. When carbohydrate intake is high and insulin is chronically elevated, it drives androgen overproduction. Combined with the zinc depletion that excess sugar causes, the result is a hormonal environment that makes oily skin difficult to control, regardless of what topical products you use. Addressing oily skin from the inside out means reducing sugar and refined carbohydrates to normalize insulin, and ensuring adequate zinc intake to restore androgen regulation. External skincare products address the symptom. Nutrition addresses the cause. Sign 3. Cracking at the corners of your mouth or cracked heels. Those small, painful fissures that develop at the corners of your mouth, or the deep cracking and dryness that many people experience on the heels of their feet, are classic signs of vitamin B2 deficiency, sometimes accompanied by vitamin B3 deficiency. Both belong to the B vitamin family, which plays an essential role in maintaining the integrity of skin and mucous membranes throughout the body. Here is a connection that most people would never anticipate. The development of cracked heels and cracked corners of the mouth is often worse in winter months, and the reason connects through vitamin D. During winter, reduced sun exposure leads to lower vitamin D levels. Vitamin D is essential for the health and balance of the trillions of beneficial bacteria living in your gut. Those bacteria, when they are thriving and properly nourished, actively produce B vitamins that your body then absorbs. When vitamin D falls and gut bacteria are disrupted, B vitamin production falls with it. This means that a winter vitamin D deficiency can express itself through skin symptoms that appear to have nothing to do with vitamin D. The body's systems are deeply interconnected. The most effective nutritional approach for this symptom is nutritional yeast, specifically the unfortified variety, which provides a naturally occurring, complete spectrum of B vitamins in the ratios your body can most effectively use. Vitamin D3 supplementation during winter months addresses the upstream cause. Sign 4. Flaking, scaly. Skin around the nose or forehead. If you notice areas of dry, flaking, scaling skin, particularly around the sides of the nose, on the forehead, or in the eyebrows, this is almost always a signal that your omega-3 to omega-6 fatty acid ratio has become significantly imbalanced. Your body requires both omega-3 and omega-6 fatty acids. They are called essential fatty acids precisely because your body cannot manufacture them. They must come from your diet. The ratio between them is critically important. Modern Western diets, particularly those that include significant amounts of vegetable oils, processed foods, fried foods, and conventionally raised meats, tend to be massively skewed toward omega-6. The inflammatory consequences of this imbalance are widespread, and the skin is often the most visible place those consequences express themselves. Addressing this requires action on both sides of the equation. Reduce omega-6 sources, which include corn oil, soybean oil, cottonseed oil, sunflower oil, fried foods, processed snack foods, and most fast food. Increase omega-3 sources, which include fatty fish, sardines, anchovies, and cod liver oil. Cod liver oil in particular produces noticeable improvements in this type of skin presentation relatively quickly, often within 2 to 4 weeks of consistent daily use. Sign 5. Yellowing of the whites of the eyes or skin. This sign is in a different category from the others because it warrants prompt medical attention. Yellowing of the whites of the eyes, called jaundice, is a sign that the normal processing and elimination pathway for the breakdown products of red blood cells has become backed up. When red blood cells reach the end of their lifespan, they are broken down in the liver. The byproduct of this breakdown includes a compound called bilirubin, which has a yellow pigment. Under normal circumstances, bilirubin is processed by the liver and eliminated through bile into the digestive tract. When liver function is impaired, when bile flow is insufficient, or when the bile ducts are obstructed, bilirubin accumulates in the bloodstream and begins to deposit in tissues. The whites of the eyes, called the sclera, are one of the first places this becomes visible. While this sign always warrants evaluation by a physician, the underlying issue often involves insufficient bile production or sluggish bile flow. Purified bile salts can help support bile production and flow, and should be discussed with your healthcare provider as part of a comprehensive assessment of liver and gallbladder health. Sign 6. Chronic persistent cough. This one surprises most people considerably. A chronic cough that does not have a clear infectious cause and does not respond well to standard treatments is frequently associated with calcium deficiency. Calcium plays a role that most people do not think about, which is regulating the smooth muscle tension in the throat and larynx. When calcium is insufficient, these muscles can become prone to spasm, producing a sensation of tightness and triggering a persistent dry cough. A small amount of calcium lactate, not calcium carbonate, taken in the evening before bed, is often remarkably effective for this type of chronic cough. Approximately 200 milligrams is generally sufficient. Calcium lactate is the preferred form because it is more readily absorbable and gentler on the digestive system than calcium carbonate. The reason this works particularly well taken at bedtime is that calcium has a mild relaxation effect on smooth muscle tissue throughout the body, which can also improve sleep quality. Sign 7. Bleeding gums or persistently red, swollen gums. If your gums bleed when you brush your teeth, if they appear chronically red, puffy, or tender, this is a classic vitamin C deficiency sign. In its most severe form, this condition is called scurvy, but the mild subclinical form producing bleeding gums is far more common than most people realize. Vitamin C is essential for the production and integrity of collagen, the structural protein that holds the blood vessels and connective tissue of your gums together. When vitamin C is insufficient, capillaries in the gum tissue become fragile and permeable. They leak. The result is the redness, swelling, and bleeding that many people have simply come to accept as a normal dental problem. Here is the critical connection that makes this deficiency more common than it should be. The molecular structure of vitamin C is remarkably similar to the molecular structure of glucose, the form of sugar that circulates in your blood. Your body uses the same transport system to absorb both. When blood glucose is elevated, glucose takes priority in that absorption system. Vitamin C gets crowded out. This means that chronic high sugar consumption does not just deplete the vitamin C your body has stored, it actively blocks the absorption of vitamin C you are trying to consume through food or supplements. Addressing bleeding gums means increasing leafy green vegetable consumption for natural vitamin C, and critically, reducing sugar to restore your body's ability to actually absorb and use the vitamin C you are taking in. Sign 8. Difficulty seeing in dim light or poor night vision. If you struggle to see clearly in low light conditions, if driving at night or in rain feels significantly more difficult than it used to, you may be experiencing the early signs of vitamin A deficiency. This specific symptom is sometimes called night blindness, and it is one of the earliest and most reliable indicators that the body's stores of active vitamin A are becoming depleted. There is an important distinction worth understanding here. Vitamin A exists in two forms in the food supply. The active form, called retinol, is found in animal products including liver, egg yolks, full-fat dairy, butter, and fatty fish. The precursor form, called beta-carotene, is found in orange and yellow vegetables including carrots, sweet potatoes, and squash. The body must convert beta-carotene into retinol to use it. Many people assume they are getting adequate vitamin A from plant sources. The problem is that conversion efficiency varies enormously between individuals, and for many people, particularly those over 60, the conversion process is significantly less efficient. Relying on plant sources of vitamin A while experiencing signs of deficiency is a common and correctable mistake. Egg yolks are among the most accessible and bioavailable sources of retinol available, and adding them to your daily diet is one of the most straightforward ways to address this deficiency. Cod liver oil provides retinol in a highly absorbable form and has the additional benefit of providing vitamin D and omega-3 fatty acids simultaneously. Sign 9. Persistently chapped lips. Chapped lips that return within hours of applying any product, that seem unresponsive to lip balms and moisturizers, regardless of how frequently you apply them, have the same nutritional root cause as the cracking at the corners of the mouth we discussed earlier. Vitamin B2 deficiency. Topical products address the surface symptom. They do not address the underlying nutritional deficiency that is preventing your skin from maintaining its normal moisture barrier and structural integrity. This is why many people apply lip balm constantly, sometimes dozens of times per day, and the chapping returns immediately. The cellular level problem is not being addressed. Eliminating refined grains from your diet removes one of the primary drivers of B2 depletion. Adding unfortified nutritional yeast provides the full spectrum of B vitamins in a highly bioavailable food form. Most people who make both of these changes notice meaningful improvement in lip and skin texture within 2 to 3 weeks. Sign 10. Swelling in the ankles or feet, particularly pitting edema. If you press your finger firmly into the top of your foot or into your ankle, and the indentation remains for several seconds or longer after you release the pressure, this is called pitting edema. And while it has several possible causes, a very common and under-recognized one is potassium deficiency combined with sodium excess. Potassium and sodium work in careful balance throughout your body to regulate fluid movement between cells and the surrounding tissue. When this balance is disrupted, with sodium too high and potassium too low, fluid accumulates in the tissue outside the cells, producing the visible swelling and the characteristic pitting response to pressure. Here is the connection most people never hear. Refined sugar specifically causes your body to retain sodium while simultaneously depleting potassium. People with chronically elevated blood sugar, those with diabetes or prediabetes, frequently develop significant lower extremity swelling as a direct consequence of this dual effect. Large quantities of leafy green vegetables are among the best potassium sources available. The amounts required for a meaningful therapeutic effect are genuinely substantial. Not a small side salad, but large portions of greens at multiple meals. A quality electrolyte supplement that is high in potassium and balanced against sodium can also address this quickly and effectively. When potassium is adequately restored and sugar is reduced, many people find that the swelling in their feet and ankles diminishes noticeably within days. Sign 11. Craving ice. This one surprises people, but the craving to chew ice, particularly when it is strong and persistent, is a recognized sign of iron deficiency anemia. The body has an instinctive drive to seek out the nutrients it is lacking. When iron stores are depleted, particularly in women experiencing significant blood loss during menstruation, or in anyone with a diet chronically low in bioavailable iron, the body generates cravings intended to motivate the intake of iron-rich substances. The connection between ice craving and iron deficiency is well documented, though the exact mechanism is still being studied. The challenge is that ice obviously contains no iron. The craving is real, but the targeted substance is wrong. Responding to the actual nutritional need requires consuming the most bioavailable dietary sources of iron, which are red meat, organ meats, particularly liver, and eggs. The form of iron found in animal products, called heme iron, is absorbed by the human digestive system at a fundamentally higher rate than the non-heme iron found in plant sources like spinach. For those who prefer not to rely on dietary sources alone, a grass-fed liver extract supplement provides highly bioavailable iron in a whole food form without the potential side effects of isolated iron supplements. Sign 12, chest pain or cardiac cramping, called angina. I want to be very clear before discussing this symptom. Chest pain can indicate a medical emergency, and any new or unexplained chest pain warrants immediate medical evaluation. Please do not attempt to self-diagnose or self-treat chest pain without first ruling out urgent cardiac causes with your physician. That said, there is a nutritional dimension to certain types of cardiac chest pain that is genuinely important and rarely discussed. Chronic deficiency of vitamin E has been associated with increased oxidative stress in the arterial walls of the heart and throughout the cardiovascular system. Vitamin E is a fat-soluble antioxidant that plays a protective role in the delicate tissue lining the inside of your arteries. It helps prevent the oxidation of fats within arterial walls, which is one of the processes that drives the formation of arterial plaques and calcium deposits. When vitamin E is deficient, the inner lining of arteries becomes more vulnerable to oxidative damage. The primary dietary cause of vitamin E deficiency is, once again, refined grains. Whole grains naturally contain meaningful amounts of vitamin E. During the refining process, particularly the bleaching process that uses chlorine to whiten flour, vitamin E is destroyed. The breads, cereals, pasta, and crackers that form the foundation of many people's diets are essentially devoid of the vitamin E that the original grain contained. When supplementing vitamin E, the form matters significantly. Tocotrienols, a specific fraction of the vitamin E complex, have been shown to be approximately 50 times more biologically active than the more commonly sold tocopherol form. If you are choosing a vitamin E supplement, tocotrienols represent a substantially more effective option. Sign 13, leg cramps or calf cramps, particularly at night. Nighttime leg cramps, which abruptly wake many people from sleep and produce intense involuntary muscle contractions, typically in the calves, are one of the most common complaints I heard from patients throughout my career. And in the majority of cases, the primary underlying cause is magnesium deficiency. Magnesium is an essential mineral that plays a critical role in muscle relaxation. While calcium triggers muscle contraction, magnesium is responsible for releasing that contraction and allowing the muscle to return to its resting state. When magnesium is insufficient, muscles remain in a state of increased tension and are prone to cramping. Magnesium is found at the center of the chlorophyll molecule, which means green plants are naturally rich in it. Leafy greens, eaten in substantial quantities, are one of the best dietary sources. For many people, however, dietary intake alone is insufficient to address an established deficiency. And supplemental magnesium, particularly in forms like magnesium glycinate or magnesium malate, which are gentler on the digestive system than magnesium oxide, can be genuinely helpful. Potassium, sodium, and vitamin B1 deficiencies can also contribute to muscle cramping, and in cases where magnesium supplementation alone does not fully resolve the problem, these should be considered as well. Sign 14, irritability, excessive thinking, nervous tension, or difficulty quieting the mind at bedtime. If you find yourself lying in bed unable to stop thinking, running through problems, replaying conversations, planning and worrying in a loop that prevents you from falling asleep, there is a nutritional component to this experience that most people are completely unaware of. Vitamin B1, also known as thiamine, plays a critical role in the functioning of the nervous system, including the regulation of a brain structure called the amygdala. The amygdala is deeply involved in the processing of fear, anxiety, and stress responses. There are receptors for thiamine throughout the amygdala, and when B1 is deficient, the nervous system can become hyperactivated, producing the experience of excessive mental activity, difficulty relaxing, irritability, tension, and the inability to mentally disengage in the evening. Nutritional yeast, taken in the evening, is one of the most effective natural approaches to this problem that I have encountered in clinical practice. The B vitamins in nutritional yeast, including thiamine, support nervous system regulation, and help shift the brain from a state of hyperactivation toward calm. Many people find that taking nutritional yeast before bed meaningfully improves both their ability to fall asleep and the quality of their sleep overall. The underlying cause of thiamine deficiency, as with so many of the deficiencies on this list, is the regular consumption of refined grains and sugar, which deplete B1 stores while providing virtually no B1 to replace what is lost. Sign 15. Persistent depression or low mood. I want to close this list with the one that I believe may be most broadly important, because depression affects so many people over 60, causes so much suffering, and is so often treated exclusively through pharmaceutical means, without any assessment of the nutritional factors that may be driving or significantly worsening it. Vitamin D is deeply involved in the regulation of serotonin, the neurotransmitter most directly associated with mood, emotional stability, and a sense of well-being. Vitamin D receptors are found throughout the brain, including in the areas most involved in mood regulation. When vitamin D levels are low, serotonin synthesis is impaired. The relationship between vitamin D deficiency and depression is well documented in the research literature. Rates of depression are significantly higher in geographic regions with less sunlight exposure. Depression is markedly more common in winter months in many populations. And vitamin D supplementation has been shown in multiple clinical trials to produce meaningful improvements in depressive symptoms. I am not suggesting that everyone experiencing depression simply needs a vitamin D supplement and nothing else. Depression is complex, has multiple causes, and in many cases requires professional support and treatment. But I am saying this with genuine conviction. The majority of people over 60 who are experiencing depression, low mood, or emotional flatness have never had their vitamin D levels measured. They have never been told that the same vitamin that supports bone health and immune function is also one of the most important regulators of the biochemistry of how they feel. If you are struggling with persistent low mood or depression, asking your doctor to check your vitamin D level is a simple, inexpensive step that could provide information that fundamentally changes the approach to your care. Bringing it all together, let me give you a clear overview of the patterns that emerged across these 23 signs, because several important themes appeared repeatedly. Zinc showed up in connection with white spots on the nails, oily skin, and hormonal dysfunction. It is depleted by sugar, and its deficiency consequences are broad and significant. The B vitamins, particularly B1 and B2, appeared repeatedly in connection with skin integrity, nervous system regulation, mood, sleep quality, and mental clarity. Refined grains are the primary dietary driver of B vitamin depletion. Vitamin D connected to cracking skin, asthma, lower back pain, depression, and the indirect effects on B vitamin production through gut bacteria. Deficiency is widespread, and its consequences extend throughout the entire body. Magnesium, potassium, and the broad category of electrolytes appeared in connection with muscle cramping, fluid retention, and cravings, all significantly influenced by sugar intake and dietary quality. Vitamin E, vitamin A, vitamin C, omega-3, fatty acids, iron, iodine, calcium, and bile salts. Each appeared in specific and revealing contexts. The common threads running through nearly every one of these 23 signs are these. Excess sugar and refined carbohydrates deplete essential nutrients at every level. The quality of the food supply means that even people making reasonable dietary choices may be getting less nutrition than they believe, and the body communicates its needs consistently and specifically through physical signs that most people have never been taught to read. At Senior Vitality Secrets, our purpose is to give you the tools to understand what your body is actually telling you, to move beyond treating symptoms and toward understanding and addressing the underlying causes. You now have 23 of those tools. Start by looking at your own body today. Not with anxiety or fear, but with informed curiosity. What might your nails be telling you? Your skin? Your sleep patterns? Your energy levels? Your cravings? Each of these signs is information, and information is the beginning of change. If today's video gave you something valuable, please share it with someone you care about. A family member, a friend, someone who has been living with one of these signs for years without understanding what it might mean. Subscribe to Senior Vitality Secrets so you never miss a new video. Leave a comment below telling me which of these 23 signs you recognized in yourself or someone you love. Your responses genuinely shape the content we create next. In our next video, we are going to explore something that affects the health and vitality of virtually everyone over 60, and that is almost never discussed directly in medical appointments: the specific connection between gut health, nutrient absorption, and the progression of metabolic disease, and the practical steps you can take to restore your gut's ability to actually deliver the nutrition you are consuming. Until then, take care of your body. Pay attention to what it is telling you, and remember that your body is not failing you. It is communicating with you. I am Dr. James. This is Senior Vitality Secrets, and I will see you in the next video.